And that's our top focus tonight. You're watching India Today with me, Nabila Jamal. Congress MP Shashi Tharoor has sparked a major row after criticizing Modi government against the COVID handling while speaking at the Lahore Think Fest. In fact, the BJP has now hit out at Tharoor, asking why did the Congress leader mock India at a Pakistan event? Let's take a listen at these details.
It's paradoxical that the government in India is not doing well and people realize they're not doing well.
Congress MP Shashi Tharoor speaking at a virtual Lahore Think Fest, attacking the Modi government's COVID fight on a Pakistan platform.
Paradoxical that the government in India is not doing well and people realize they're not doing well in terms of managing COVID.
Even questioning India visit of US President Donald Trump this February.
The Congress leader Rahul Gandhi had mentioned as early as February that COVID had to be taken more serious and the government was taking it, and that preventive measures had to be put in place immediately. Whereas the government was not only complacent, the following month they invited President Trump for a grand reception. All of the stuff that you're not supposed to do if you want to prevent contagion.
The BJP hit back at the Kerala MP, defending Modi government's COVID response and calling Tharoor's word a smear campaign against India on a Pakistani podium.
हिंदुस्तान ने नरेंद्र मोदी जी के नेतृत्व में किस प्रकार से अपने आप को सुरक्षित रखा, किस प्रकार से हाईएस्ट रिकवरी एंड लोएस्ट मोर्टेलिटी अगर कोविड को लेकर पूरे विश्व में है तो वो हिंदुस्तान में है, उसके बावजूद इस प्रकार का स्टेटमेंट देना कि इंडियन गवर्नमेंट हैज फेल्ड, वह भी लाहौर में, आप सोचिए किस प्रकार की मनस्थिति कांग्रेस पार्टी और राहुल गांधी जी के अनन्य मित्र शशि थरूर जी की है. Since he's probably planning to contest election from some place in Pakistan, probably Lahore, because the debut rally was in Lahore. So we would henceforth call Rahul Gandhi as Rahul Lahori.
The Congress MP even alleged religious persecution of Muslims in the garb of pandemic fight, evoking strong reaction from the BJP.
Puritan Islamic sect, the Tablighi Jamaat, had held a major gathering just before the first lockdown in India, whose attendees spread the infection to many states when they returned home. And this was used to justify open bigotry and discrimination against Muslims.
शशि थरूर जी, राहुल गांधी जी, एक बार भी आप लोगों ने पाकिस्तान के किसी भी मंच पर यह कहा, पाकिस्तान से पूछने की हिम्मत की कि पाकिस्तान किस प्रकार से कट्टरता दिखाता है?
The Congress came out in support of Tharoor, accusing the BJP of using Pakistan to hide its failure.
The strategy of the BJP party always to resort to the whipping boy Pakistan, Pakistan, Pakistan. Only to hoodwink the common people from the stark reality.
Significantly a large number of people get the infection, don't show any symptoms.
Pakistan may not be the best example to give by Shashi Tharoor on a global platform, but he set the ball rolling. One is that India's fight against COVID-19 has had brickbats and bouquets both on social media as well as global media platforms. But what Shashi Tharoor has done has drawn ire from the BJP. This has now degenerated the entire debate into pure politics, as many would put it. With cameraperson Vakar, this is Kamaljeet Sandhu in Delhi for India Today. Now, just like every other country is currently fighting the raging COVID-19 pandemic, India is also fighting hard. We're currently looking at a second wave across of many other countries. India too is reporting a spike in cases. Now, at a time like this, can we criticize India when spirits are already dented? Can we criticize India on the international platform and not just any other platform at a Pakistan stage? That's the controversy here with Shashi Tharoor speaking at the Lahore Think Fest. Joining us, our guest today, KV Dhananjay, advocate and columnist. We also have Dr. Sanjeev Bagai, who is the chairman of Nephron Clinics, who's also a Padma Shri awardee, to give us a perspective on the coronavirus pandemic and how it was handled from the start to today. We have BJP spokesperson joining us, Gopal Krishna Agarwal. Now, let me make it clear, the Congress spokesperson has refused to speak on this. They don't want to comment. We've heard what Adhir Ranjan Chaudhary said, Abhishek Manu Singhvi said. They said this is trivial. If we're going to fight on this, then we're only dismissing our democratic rights. That's what's Congress's stance here. But let me quickly go over to the BJP spokesperson. Gopal Krishna, what is offensive here? That here Shashi Tharoor criticized the way India handled the COVID pandemic, or was it that he spoke at a platform presented by Pakistan?
The thing are all we have to look into the whole statement. He not only criticized India's handling on the corona crisis, that way he was also wrong on the facts. One thing, though the problem of corona is important, there is a case where we can have difference of opinion, one thing, but he has not set the facts right, one thing. And then he chose to compare India's fight against corona with Pakistan and that platform, which is an enemy country of the nation. And now this whole statement will be used by that Pakistan for and other people on other international platform. And it is not only corona. The important part is he talks about the religious discrimination, which is not at all. If you look into the whole issues, that is driven by political agenda. Where is the fact that he is talking about the Muslim discrimination in India? Why are Muslims being discriminated because of corona in India?
He's mentioning the Tablighi Jamaat event. Now, clearly, he's spoken at the Lahore Think Fest is what actually bothers the opposition that much. Is that that's the question here that I ask you, Gopal. But let me quickly take in KV Dhananjay here. Mr. Dhananjay, according to you, is it all right for a person like Shashi Tharoor, who's an MP, he represents the sentiments of a large population. He speaks at a global platform, not just any other place, but a Pakistan platform, and criticizes India's handling of the COVID-19 pandemic. This is the first for everyone. Let's all agree with this. No government in the world imagined, even wildly imagined, a situation like this would be presented. It's the quick response of a government that really qualifies whether they handled it right or not. India did go into an early lockdown, didn't we?
Well, it's true. And I think there are many ways to look at it, and nobody should be just giving it a political color. Mr. Tharoor's statements could only be defended by him and by no one else, and that he's chosen to not defend it. I don't know what inference people should draw from his refusal to openly or publicly defend it. But, as I see it, the people in Pakistan might see this as a testament to the vibrant democracy that India is, that the Constitution of India assures to the people of this country the freedom to criticize its government. And by the way, you wouldn't call a democracy as a democracy if people don't have the right to criticize their government. And it doesn't matter the occasion for criticism. It could be a public emergency, or it could be
fine, but sitting at a platform which is presented by Pakistan at a time when we are fighting issues in Jammu and Kashmir, we know what's happening at Pakistan-occupied Kashmir, the kind of instigation that Pakistan has had time immemorial. And not just that, they also, their affinity with China, what's happening at the line of actual control and the line of control. Pakistan has a huge hand to play. Are we ignoring public sentiments and sitting there to only gain brownie points, political brownie points there?
Well, it's a great question. Now, I think the issues are so very complex. What Pakistan does to us on Jammu and Kashmir is different from a citizen of India finding fault with his own government. Now, you were very right. This was a novel situation for the government of India. And by the way, nobody should have expected Mr. Modi to work out any magic, because when he came into power, he inherited a deeply broken public health infrastructure. So it's a very complex issue. And the fact that we have differences with Pakistan on a number of issues does not mean that citizens of India have to behave as if they are like the citizens of, let's say, Saudi Arabia or North Korea. I mean, imagine, we should be proud of the freedoms that we have, and we cannot be unless and until we express it in this manner. And I think the larger question that we must be looking at is, perhaps there should have been more criticism of the central government, because in the first 3-4 months, the response was really very lukewarm.
Do you agree with Mr. Dhananjay that India has handled the BJP government, Modi-led government has handled the COVID pandemic well or not? What's your perception here?
Well, I think I think it's a great question, but instead of giving a binary answer in yes or no, I would say I think they've done what they could do best. But then Again, it's the state governments also. Look, Mr. Tharoor is from the Congress party, and there are so many Congress states that have performed so very miserably, and he should have highlighted that as well. The fact that it is, made all about Mr. Modi, I think that's very distorting. Like I just said, there was no border control that we could have imposed in India because we have a 4,096-kilometer border which we share with Bangladesh. We have rivers, we have forests, and of course we have the Bay of Bengal. We could not have, taken on border control measures like New Zealand did. But there were things that we could have done in the first 3 or 4 months, which we didn't really do. The testing kits, they were never really approved for 2 months, full flat. And testing was the key to containing this. What did we do in the first 2 months? Well, testing kits were not there. And, it was a mess in those 2 months. And migrant, crisis, Mr. Modi should have taken the consultation of more people, and he should have made it a consultative exercise. And people don't expect to see an Iron Man at the center when things like this happen. And we are vulnerable. We were dealing with a virus. It's a novel pathogen. And by the way, a lot of people feel, oh God, we've done a great deal when it comes to beating the bacteria. Why haven't we done enough? But the fact of the matter is, we've done, of course, a great deal while beating bacteria. But as far as our viral knowledge is concerned, many experts would say it is still very rudimentary. So we were dealing with a novel pathogen.
It is, but have we acted upon right in time? Is the question here. Let me take it to Dr. Sanjeev Bagai. Doctor, we entered lockdown in the early months of COVID-19, but nonetheless, we do agree that the warnings came from the international forums much in advance, much before we actually announced a lockdown. Do you believe India has handled the pandemic situation right? Where could we have gone wrong?
Good evening, everyone. Just to put everything in a right chronological order, this is one of the most catastrophic global hits, which is it's a frontal attack on humanity. No one anticipated it. It's like the full world going for an exam which you don't know what the subject is and you're unaware of the syllabus. So I think the entire globe was caught unaware. It's not only an India-centric thing. And it's neither the globe's or India's fault, because this was a completely new entry into a human being. I won't go into the exact medical details. I can speak for hours on it. But putting things in the correct perspective, we've had huge outbreaks, be it epidemics or local outbreaks or indeed pandemics in the past. This is not the first one, and I'm sure it won't be the last. We've had Zika outbreaks, we've had Nipah outbreaks, we've had MERS, we've had SARS, but no country like before has gone into a lockdown. So to put things in a chronological order, I don't think the government could have done anything better.
You think, like Mr. Dhananjay picked on the point that tests weren't done, sufficient tests weren't done, we did not test right initially. Could we have done it better then?
Can I just complete, because I think it's extremely important for all the viewers to know the medical facts. It's of paramount importance that when you are dealing with a completely new genome, we must get the genome right before we get the tests and therefore the treatment and the diagnosis. All this was absolutely new. The test kits which had come initially
were not very... You had other countries testing already, Mr. Bagai.
Sorry?
You had other countries already testing at that point of time.
Yeah, but it takes time because it was a procedural delay. But I think overall, if you look at the performance of India, in spite of 550 Indian doctors dying in fighting this as frontline warriors, India having 2% of the land mass has 20% of the global population. We had a huge deficit of chronic underfunding for the last 75 years of public health care. We had 10 lakh doctors shortage and nurses shortage. Keeping all that aside, we've had one amongst the lowest mortalities in the world. Belgium tops the list with 88 people dying, unfortunately, out of every 1 lakh. India has 0.7. We've got a huge amount of comorbidities in India, huge amount of poverty and illiteracy in India, and it is metro-centric healthcare. In spite of all these drawbacks which we began with, I think India has done a fairly good job. We cannot put our guard down. There is no point in criticizing the government because that's not going to give any relief to anyone. I think health is neither a central, neither a state subject. I think it's an individual subject.
Right.
And if
Mr. Bagai, do stay
individual
with us.
does
Let me
not
take
take
that question
care,
to Gopal
we will
Krishna.
not win this
Gopal,
battle.
here you heard what Dhananjay and Mr. Bagai said very clearly. Mr. Bagai said that there could have been procedural delay, which is why tests may have been delayed, but otherwise the government handled it well. But procedural delay at a time of a pandemic, it's an emergency situation. All of us have got to act. Do you believe that the government handled it right? Of course, your vote will be for the government handling the right way. But nonetheless, if the opposition is criticizing it, is it unfair to pull up the flaws? Because this is a situation where people need to speak up. And if the opposition is doing its job, what's wrong?
The issue is that today we have to look into three things very importantly. One thing is today's debate is neither whether the Indian government handled the COVID crisis well or not. It may be perception, there may be different analysis, there are certainly here panelists also saying that there can be difference of opinion, but largely people agree that India has done well in containing COVID, because if you see much ahead advanced countries like US, China, etc., there have been different problems. India also has certain problems, but the issue is that we have done a fairly good approach with regard to low mortality and recovery rate. This is one thing. But the main issue is about Shashi Tharoor talking on a negative perception, which he does not fully supported from analysis and data, and talking at a foreign platform. And this is not the only issue that he's talking. He is talking about other issues also.
He's not legally bound against it, Mr. Gopal. There's no law that says that he cannot speak at a Pakistan forum. He can very well travel if he wishes to. He can very well speak if he wishes to.
Let me complete. It is not only Mr. Tharoor's issue. It is now Singhvi ji is supporting him. Adhir Ranjan is supporting. Rahul Gandhi did the same thing with China. Pakistan, his statements are being used at
that's precisely when
so this is the psychology
freedom of
which
expression would come into play here, isn't it?
No, it is the psychology with Congress is working. That's what they neither respect Indian approach, neither respect the Indian government, and their personal dislike for Modi is going to such an extent that they can criticize at a foreign forums.
Right. Mr. Dhananjay, here, is it all right for Shashi Tharoor to be speaking at a Pakistan forum? Here, clearly the BJP doesn't have a problem of them criticizing the government's handling of COVID-19, but why speak at a Pakistan forum?
And not only
I
for
think,
Corona, other things
yes, what we need is...
which are more blatantly wrong about the Tablighi Jamaat, even Northeast people. The diversity has also been questioned by him.
He also speaks about the Muslim divide that the government is creating, pointing out at the Tablighi Jamaat event. I mean, is this political brownie? Also, you're talking at a platform where the nation majority population is Muslim. So what really is this?
Well, it's understandable. I think Mr. Tharoor spoke as a politician, and the few minutes that he spoke, it's obvious that there is no context. What's the basis for Mr. Tharoor to say that he finds fault with the decision taken by Mr. Modi? I think he should be able to explain, and I don't think he's done that at all.
But is it all right for him to be speaking at a Pakistan platform, considering we've cut all ties with Pakistan so far? All business connections have been sworn.
Yes, of course. Yes, notwithstanding all of that, I think we need mutual dialogue at all times. No one is going to bay for blood, and no one is going to say war is a solution to anything. It's important that civilians speak to each other, and if this is going to open up more dialogue between the civilians in both the countries, why not? But that's not what I am hinting at. You see, again, there was this, the opinion can always be divided, but then, in April and May, we were writing about it, we were talking extensively about it. I was representing a couple of groups that wanted to hold clinical trials. And at that point of time, we were so much frustrated with the attitude of the ICMR. It was such dictatorial in those days. And we will come to other things like, India has unique problems and we can't expect the Western world to give us guidance. We have 21 crore users of chewing tobacco in this country, of which 17 crore users use it daily, which means on an average, every person who consumes chewing tobacco spits 3 times a day. So we had 51 crore spits in public places every day. And what did the central government do with regard to that? Notwithstanding that state governments alone have the power to curb or control or prohibit chewing of tobacco, the central government issued a notification and just left it there. Most of the states have done nothing about it. And it is in that context, I think we might have to find fault, not just with what the central government has done, but with also the fact that state government...
here, Mr. Dhananjay, is that we announced an early lockdown. The Prime Minister announced an early lockdown. It was quick action. What more do you want? What more can be done?
Yes.
And international travel
if you look at all the
was banned
countries of the world,
by India.
Yes.
Right, international travel was stopped by India. A series of issues was addressed, and all that, it more or less looked like a blanket solution was a lockdown. Do you think that was the most effective way to handle it?
By the way, lockdown was never an end in itself. Lockdown was only a means to an end. And the period of lockdown was meant to be used to make sure testing happens extensively. And the first two lockdowns we squandered because testing was not happening. Notwithstanding that ICMR might have its own explanation, Bahrain and Iceland, Singapore and Hong Kong, they were already testing. Germany was in fact doing so well with testing kits. We could have approved one of those. We didn't. So the fact of the matter is, we bungled it in the first few months, and I believe we continue to see the impact of it. Look at our economic downfall. India is the major country with the steepest fall in economic recovery. So, and also there is some parallels for this. You go back to 1918. The Spanish flu then didn't kill people all in 1 year. It took about 2.5 years. So we don't yet know what the future holds in store for us. And India has been steadily climbing the charts. And even within India, you take the state of Karnataka, while it was at the 11th or the 12th scenario before it conducted the 10th standard examination, people were appreciating Karnataka as a model state, but now it's almost at number 2 when it comes to daily number of cases.
So that's the question that arises. I'll take that to Dr. Bagai. Dr. Bagai, was the lockdown a one and all complete answer? A blanket solution was a lockdown. Was that the only thing that the government could have done? And is that the best possible way that they actually curbed the virus? We're looking at the situation mounting even as we speak today. We're number 2. We could well be number 1, beating the United States any point now.
The important point here is in 3 parts. One is, if you look at the Indian population, it's 5 times that of US, and 1/5 the health infrastructure which the present government has inherited. I'm keeping this answer as completely apolitical. So when you look at this kind of situation, lockdown is primarily done, and I think it's a great compliment to the present government to do an early lockdown, a strict lockdown, a complete lockdown, and I dare say we would have probably saved many hundreds and thousands of lakhs of human lives. I think our strategy was to put human life first, and human life cannot be equated with any money or any monetary loss or gain. But having said that, the important point of lockdown is to get 3 things ready. One is to get the government protocols and infrastructure ready. 2 is to get the medical infrastructure and ICU number of beds and the protocols ready and the ventilators ready. And 3 is to sensitize the society. And I think the end point of the lockdown, as far as its aim to achieve these 3, was pretty much achieved. Now it is up to the society. I find it very strange, that anyone wants to criticize. It's very easy to criticize. If anyone has a good, sensible suggestion, why don't they put it forward to the government? If it's good, why will a sensible person not implement it? If it's for the benefit of India, benefit of the nation. I think we are dealing with a huge, huge catastrophic problem. We are not in the end of it. We will only create negativity if we criticize the government.
No, but that's precisely why questions are required at this point in time, don't you think? KV Dhananjay, if there is a solution that you have, why don't you put it forth?
I can give you a long list of letters.
If it is logical, then the government will pick it up. What would be your reaction to that?
Well, okay, great. I think that's a great suggestion, but in real world, I don't think it really works. April, May, June, I can give you a large number of bound volumes of letters that we were writing to the central government, telling them to do something or the other. Of course, we were giving concrete suggestions, but that was not acted upon.
Like, for example?
But that's all right. Like for the clinical trials, I personally wrote to the ICMR, to the central government, to the Union Health Minister, telling them that their protocol for approving clinical trials was flawed, and that there were efficacious methods under the Drugs and Cosmetics Act of 1940, which they have to follow so that they can speedlight the clinical trials that they never did for the first 3 months. Convalescent plasma, which seems to be showing a great deal of promise today, was already being tried then in April. And I can tell you several doctor groups simply gave up because the ICMR was so deaf and blind at that point of time. So it's all right to criticize, and I don't think we have to worry about negativity and all that.
No, but we heard what Dr. Sanjay Bagai said, that there was shortage of 10 lakh doctors. There were no PPE kits. Whose fault is that?
Well, of course, the fact of the matter is the ICMR didn't approve testing kits within time. And if that had happened, okay, we had a shortage, but we did still have doctors, right? So wherever we had the doctors, they would have been able to test people more widely. And that was critical to containing this in the early days. Now, nobody should be, in fact, giving a verdict as to which country has done well in this epidemic because, we don't yet have a vaccine and everyone's talking about a vaccine next month or maybe next year. AIDS or HIV has been around for 40 years, and there were a few Hollywood films that were made on that, and then a couple of Oscar awards, and yet we don't have a vaccine for HIV despite having tried again and again. So nobody knows what the future holds in store. But nevertheless, the fact of the matter is, I don't think we really did great. And also take the United States. In 2018, worldwide, we had $420 billion spent on military, right? And look, it's of no use. We all need to spend more on public health. And as far as India is concerned, I think it's very true. And it's also very unfair to blame Mr. Modi alone because he inherited a country that had such abysmal public health infrastructure.
Undoubtedly.
In 2013 and 14, whatever India claimed to be its number of tuberculosis infections, the Lancet magazine, a very prestigious British medical journal, analyzed the kind of prescriptions that were being given out to infectious TB patients. And they said we were hiding almost by 200%. And we were not even being transparent enough. And that probably would not have happened if enough people had criticized the government. And it is in that context, I keep telling that when it comes to public health,
you're saying criticism
we need
is a
more
must.
criticization.
Criticism is a must. And that's
criticism is a must. Look at state of Kerala.
Gopal Krishna, criticism is a must. If there's no dialogue, then how are we going to be seeing improvement?
Definitely, I agree that in a democracy, public participation in the discussion, decision making, policy making is important, but the time is also an important factor. And we have to also understand here that our government has never said that the lockdown is the solution for COVID. Mr. Bhagai also said, and we always had been saying, that this lockdown was for buying time because we inherited a very poor infrastructure with regard to health facilities. We had not a single industrial unit in India manufacturing PPE kit. And we allotted first thing tranche was 62,000 crores in the health sector, pharmaceutical sector to improve the health infrastructure. That was the first package of economic help which the government gave to of rupees 62,000 crores. So that was the time which helped into building the infrastructure. And once this infrastructure was built with regard to ICU units, with regard to testing, with regard to oxygen provision machines, etc. And now our infrastructure has improved. So then only we are moving. We also know there was problem with rapid tests, how they were imported, and later on it was found to be quite below standards. So
right. There were several delays, procedural delays, several hiccups. It's a new for all, for any government for that matter. And whatever could have been done was done, but was it effective enough? That was the question here. But do stay with us, Gopal. Let me take that to Dr. Sanjeev Bhagai. Doctor, we're looking at a second wave that's been reported in many parts of the country. It is quite a grim situation. Even in India, we're looking at cases only on the rise. We're touching 75 lakh. Death toll has crossed 1,15,000. Even though the mortality rate has dropped, but yet it's a matter of concern considering several other countries have reported the second wave of COVID-19. In fact, in India itself, in one day, 1,033 deaths were reported in just 24 hours. Do you think the peak is yet to come in the country? And are we prepared this time around?
Is that question for me?
Yes, sir.
Yeah, I don't think we are looking at a second wave as yet. I think we are still grappling with the first wave. We are still underwater right now, so it will be irrelevant to count the number of waves above us. We are still battling the initial surge. We will see fluctuations of numbers. The winter is going to be actually a twindemic. It's not going to be a pandemic alone because we are going to see a huge resurgence of the seasonal flu, what we call as influenza. We also know a lot of people will be indoors in winter because of the cold, the children and the elderly. And we know indoor transmission is a very important core part of COVID transmission. But a quick word on what we've really done. And I want to highlight the huge effort of the entire medical fraternity in India who work so tirelessly, selflessly, with so
Undoubtedly,
and
there are
dedication.
COVID warriors, but are we prepared this time around, Mr. Bagai? On a quick note as I wrap here.
Yes, absolutely. I think we are very much well prepared. There is no shortage of ICU beds. There's no shortage of medication and drugs. The amount of research papers which are coming out from India have been phenomenal. We've created a great awareness for the comorbidities, especially for obesity, for hypertension, cardiac diseases, and so on. I think there is a great awareness now of Mask India, and I think hand washing, keeping social distancing. This war is not over. This battle is not over. We have many months further to go. I will still request everyone, don't bank on the vaccine immediately. It's many months away, and the vaccine itself may be just 50 or 60% efficacious. And we also
There's a lot of talk about how the COVID strain could be much lighter this time as the days progresses, the strain and the intensity, in fact, the strain itself is losing its intensity there. Is that true?
No, that's not true. That's not true.
Hopefully, yes, but we still have to wait and see how the next 2 or 3 months, which are critical, how they pass by. But the entire initiative to bring the numbers down will be social distancing and masking. If we just keep these two precautions in mind, there are enough studies worldwide to show almost a 40% immediate decrease in transmission if we keep these two factors in mind.
Right.
So now I would really say that it's a social movement. The government only is giving instructions. It's up to us as citizens to follow it meticulously.
So now it seems like all of us have thrown our hands up because the economy is crashing here. We've got to get business up and running, so everything is open. Considering that business now is back to normal, are we prepared to handle the surge in cases is the question here. Dhananjay, I'll take that from you there. You said no to the strain losing its intensity. A quick word from you as a wrap.
Yes, I think the World Health Organization is advising everybody not to fall into that hope that the strain is going to become less virulent, because we don't yet know. And, when it comes to the seasonal flu itself, I can tell you about, a discussion in the Lok Sabha where the Union Health Ministry gave this laughable data. It spoke about something like 250 deaths in the whole territory of Delhi so far as seasonal deaths are concerned. That's not how we lose people to seasonal deaths. We lose tens of thousands of people. The problem is we don't have proper data collection. And because we don't yet have proper data collection, we tend to self-congratulate. And take the territory of Kerala, which is Tharoor's home state. Somebody made a film, praising Kerala's response, put it up on Netflix, and so see where Kerala is. I think in this country, people take congratulations too dearly to heart. And I think we need to congratulate less and criticize more. Look at Kerala itself.
Congratulate less and criticize more. And that's what Shashi Tharoor did at the international platform. But it's Pakistan, therefore it hurts sentiments. Dhananjay.
Well, yes. I think Mr. Shashi Tharoor, as a politician, again, he should have in fact spoken about the fault of Pakistan in a forum like that. And I think he was
in fact lauded Pakistan's effort. He said Pakistan has handled it better, but not India.
Well, you see, I think because India and Pakistan issues are always contextual, he should have also spoken a bit about and then found out what would have been the response of the organizer. Perhaps the organizer might have muted him or thrown him out. I don't think he took that risk. And to that extent, I think it was a bit dishonest. If you are in a forum in that manner, I think you should also highlight the atrocities that Pakistan routinely commits on our citizens in Pakistan, in Kashmir.
Absolutely. Dhananjay, thank you very much. I'm going to leave it at that. Thank you very much, Mr. Gopal, with Dr. Sanjeev Bagai. Well, we are looking at the pandemic raging on. We heard some tips from Dr. Sanjeev Bagai there on social distancing. You've got to keep your act together, continue to be safe, wear your masks. Here, criticism follows, even as India handles this with much spirit. Thank you for watching.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.